We're going to be doing lumbar traction this time. My time will start whenever I touch the first piece of equipment. I'm going to go ahead and get set up. Inspect my wires and plugs for frays and tears. Go ahead and plug in my device. Also going to check my safety switch for frays and tears. I'm going to plug it in. Okay, I'm going to go ahead and test my safety switch, make sure it works, and it does. All right. For this lumbar traction, I want to check my table, make sure the sliding mechanism works, and turn it all the way up and close it all the way. All right, check my strap, make sure the Velcro works. Make sure I've got my ring. All right, and I need to make sure that my belt is looped through the back of the lumbar strap. I want to place this just below the opening in the table. Check my upper strap. I'm going to hook it over the top, right in the center. Pull it down, and it should sit right above the opening in the table. Everything looks good there. I've checked my table. All right, I think it's time to go get my patient. All right, come on in and have a seat. My name is Stastor Mulvaney. I'm going to be a physical therapy technician today. What is your full name and date of birth?
Rafael J. Hernandez, Tuesday, November 6, 1979.
Okay. It says you're coming in for some low back pain and some numbness tingling down your right side, and that you have disc herniation L4, L5. Does that sound right?
Yes.
Okay. What's your pain coming in today?
I was at about a 4 on this side.
Okay. Have you ever had traction before?
No, first time.
Okay, so what you should feel, we're going to put some straps on you. They're going to be pretty tight, all right? We need it to be tight so that it's not sliding up and down on you. And what you should feel is just be a pull, but it shouldn't be uncomfortable or painful. So we'll let you know what to do if you do feel any pain or discomfort, all right? Any issues that would affect treatment today?
Nope.
Okay, so what I have you do is go ahead and lay back in the harness. You're going to lay with your head down this way. You see where this space is right here between the straps? I want you to try to put your lower back right here for me, okay?
All right.
Go ahead and remove your shoes and anything that's in your pockets. And if you have anything in your mouth, please take that out as well.
Nope, good.
All right. Go ahead and lay back. I'm also going to give you a pillow for comfort, okay? All right, looks pretty good. I'm going to raise you up before I do anything else. All right, that looks pretty good. Okay, so I'm going to strap you in, okay? It's going to be pretty tight. All right, all I need is for you to be able to breathe, okay? I'm going to have you take a deep breath, all the way in. Let it out. Can you breathe?
Yeah.
Okay. Okay, we do it one more time. Deep breath in. Let it out. All right. Can you breathe?
Yeah.
Okay. seatbelt on. Careful not to twist him while I'm doing it. Okay. Okay, that's through there. Now, I'm going to put a stool underneath your legs for you as well. How's that feel?
Good.
Is that right there? Don't cross your legs for me. I want you to keep them separate throughout the treatment, okay?
Okay.
I'm going to adjust the stool over this way just a little bit, okay? This way it's out of the way of the rope. Alright, I want to check my alignment. Okay, looks like he's lined up. Alright, I'm going to give you a few things here. Let me give you a safety switch. This is in case you have any significant pain or discomfort. If you press this button, it's going to stop the machine. It's also going to go off and let me know that something's going on, okay?
Okay.
So hold on to that. I'm going to give you a bell as well. Okay, this is in case you have any questions throughout the treatment. You ring the bell. It'll let me know to come and check on you in case I'm not here at the time, all right?
Good.
Okay. I'm going to go ahead and go in and set up my parameters. Okay, so I was doing intermittent traction. I've set everything to intermittent. Change my max level. What is your body weight?
171.
171. So I'm going to start at about half that. So 170 divided by 2, that's 85. So we're going to start with 85 pounds. And minimum level, half of that, let's say 40 pounds. If I'm doing static, which I'm doing for this patient, I won't have any min level. I can't even change it because it's static. It'll be a constant hold. Otherwise, I could change my hold and rest time if I'm doing intermittent traction. We're going to do 2 steps up, 3 steps down, and we're going to change our time to 20 minutes. Okay, I'm going to step back and have my grader verify my parameters.
Very good.
Okay, so grader's verified my parameters. I'm going to step over and unlock the table. Table's unlocked. Come back, press start treatment, and get this notification. It says current max level is 85 pounds. Cervical traction should not be performed with a tension greater than 39 pounds. Indicate the type of traction being performed. We are doing lumbar traction. Okay, good to go. All right, so at this time, I just want you to relax, okay? Let it take up tension. Again, if you have any significant pain or discomfort, just go ahead and press that red button, and that'll stop the treatment, okay? And let me know. All right, so we've reached 85 pounds. I'm gonna stand by and monitor for 2 minutes or 2 cycles to watch for signs of slippage. So 2 minutes is if we're doing static, it's gonna be holding for that time. 2 cycles would be those intermittent cycles. It's slipping, so what I'm going to do is pause the treatment, and I'm gonna wait for the tension to come all the way down before I do anything on my patient. You doing okay?
Okay.
Okay, we just want to adjust the straps this way it's not sliding up and getting uncomfortable, all right?
Okay.
All right, now the tension's come down, the first thing I'm going to do is lock the table. This way, as I'm adjusting the patient, the table's not moving underneath them, just for safety. I'm going to go ahead and undo all my straps. We go right back to the same process we started with, okay? Deep breath in, let it all the way out. Deep breath in, let it out. How's that feel? They both feel tight?
Good.
got all my straps redone. Just gonna make sure everything's done. Okay, the last thing I do for a re-engage treatment is unlock the table. I'm gonna go ahead and press start again. We'll see if it holds this time. All right, we're back up to max pull. How are you feeling right now?
Good.
Okay, looks like everything's holding. I'm gonna leave and return periodically. I'm gonna go check on other patients. Again, anything happens, you feel any significant pain or discomfort, press that red button. Again, I'll hear it and come back and check on you. And if you have any questions, go ahead and hit that bell for me, all right?
All right. Sounds
I'll
good.
go take care of my other patients. I'll be back. All right. See you press the button. You feeling okay?
Yeah, I just start to have some pain, like I mentioned at the beginning, on the right side of my lower back.
Okay. No problem. We're doing discontinued treatment. I've got it coming down. We'll get you out of here, all right?
All right.
All right, tension's come all the way down. The first thing I'm gonna do is wash my table again before I make any adjustments to the patient. And then I'm gonna go through that same process I did whenever I was setting them up, only reverse, take everything off. Take this tool from you. I'm gonna help you with your legs. Okay, I'll slow you down. All right, you comfortable right there?
Yes.
All right, I want you to just relax there for 5 minutes, okay? All right, 5 minutes have elapsed. How you feeling right now?
Good.
All right. I'm gonna have you sit up. Feeling okay? Okay? Dizziness, lightheadedness, anything like
No.
that? All right. Go and slide your legs around and lay you down slow. All right, what's your pain at now? 0 to 10.
We'll set up at a 4.
Okay, what about the tingling numbness that you came in with on your right side? Are you still feeling that? Is it any better?
No, I don't really feel them.
Okay. If you don't have any questions for me, you're good to go. Make sure you put your shoes on before you head out.
All right.
All right. Again, I'm going to wipe down all my equipment. And sanitize.